Question 1. What is a characteristic finding of a sinus arrhythmia on the ECG? A. The PP interval varies with respiration. B. The QRS complex is wide and irregular. C. The heart rate is consistently above 100 BPM. D. The P wave is absent. Answer. A. The PP interval varies with respiration. Rationale. Sinus arrhythmia is a normal variant where the PP interval varies with the breathing cycle. Options B, C, and D describe other types of arrhythmias. Question 2. Which of the following best describes the rhythm of ventricular fibrillation? A. Regular and slow. B. Chaotic, with no identifiable P waves or QRS complexes. C. Regular and fast. D. Irregularly irregular with distinct QRS complexes. Answer. B. Chaotic, with no identifiable P waves or QRS complexes. Rationale. Ventricular fibrillation is characterized by chaotic electrical activity with no identifiable P waves or QRS complexes. Question 3. What does an elevated ST segment on the ECG most commonly indicate? A. Atrial fibrillation. B. Myocardial infarction. C. Hyperkalemia. D. Sinus tachycardia. Answer. B. Myocardial infarction. Rationale. An elevated ST segment is a key sign of myocardial injury, such as a STEMI, ST elevation myocardial infarction. Question 4. Which of the following ECG changes is indicative of hypokalemia? A. Flattened T waves. B. Shortened QT interval. C. Peak T waves. D. Elevated ST segment. Answer. A. Flattened T waves. Rationale. Hypokalemia commonly causes flattened or inverted T waves. Peak T waves are associated with hyperkalemia, and a shortened QT interval can occur with hypercalcemia. Question 5. What does a prolonged QT interval increase the risk for? A. Sinus bradycardia. B. Torsades de pointes. C. Atrial flutter. D. Heart failure. Answer. B. Torsades de pointes. Rationale. A prolonged QT interval can lead to a type of ventricular arrhythmia called torsades de pointes, which is life-threatening. Question 6. In which of the following scenarios would you expect to see a sawtooth pattern on the ECG? A. Atrial flutter. B. Sinus tachycardia. C. Atrial fibrillation. D. Sinus arrhythmia. Answer. A. Atrial flutter. Rationale. The sawtooth pattern of P waves is characteristic of atrial flutter, where rapid atrial depolarizations are observed. Question 7. What is the hallmark feature of atrial fibrillation on the ECG? A. Regular P waves before each QRS. B. Absence of P waves and irregularly irregular rhythm. C. Progressive PR interval lengthening. D. Wide QRS complex. Answer. B. Absence of P waves and irregularly irregular rhythm. Rationale. Atrial fibrillation presents with an irregularly irregular rhythm and no distinct P waves. Question 8. What does the presence of Q waves on the ECG typically suggest? A. Acute myocardial infarction. B. Atrial fibrillation. C. Hypertrophic cardiomyopathy. D. Left ventricular hypertrophy. Answer. A. Acute myocardial infarction. Rationale. Q waves are typically seen in the ECG of patients who have had a previous myocardial infarction. Question 9. What ECG finding is characteristic of second-degree AV block, type 1 Wenckebach? A. Progressive PR interval prolongation followed by a dropped beat. B. Regular PR interval with dropped beats. C. Wide QRS complexes with no P waves. D. Constant PR interval with normal QRS. Answer. A. Progressive PR interval prolongation followed by a dropped beat. Rationale. In Wenckebach, the PR interval progressively lengthens until a QRS complex is dropped. Question 10. What is a key feature of first-degree AV block? A. Dropped beats without a preceding PR interval prolongation. B. The PR interval is consistently greater than 0.20 seconds. C. The QRS complex is absent. D. Atrial rate is faster than ventricular rate. Answer B. The PR interval is consistently greater than 0.20 seconds. Rationale. First-degree AV block is characterized by a prolonged PR interval, greater than 0.20 seconds, with no dropped beats. Question 11. What is the characteristic feature of ventricular tachycardia, VT, on an ECG? A. Narrow QRS complexes with a regular rhythm. B. Wide QRS complexes with a regular rhythm. C. Irregularly irregular rhythm with no P waves. D. Progressive PR interval lengthening with dropped beats. Answer. B. Wide QRS complexes with a regular rhythm. Rationale. VT is characterized by wide QRS complexes and a regular, rapid rhythm. Question 12. Which of the following ECG changes is associated with hyperkalemia? A. Wide QRS complexes. B. Prolonged PR interval. C. Peak T waves. D. Flattened T waves. Answer. C. Peak T waves. Rationale. Hyperkalemia typically causes peak T waves, and in severe cases, it can lead to wider QRS complexes. Question 13. What does a U wave on the ECG most often indicate? A. Hypercalcemia. B. Hypokalemia. C. Hyperkalemia. D. Atrial fibrillation. Answer. B. Hypokalemia. Rationale. U waves, which appear after the T wave, are most often seen in hypokalemia. Question 14. What is the normal duration of the PR interval? A. 0.12 to 0.20 seconds. B. 0.08 to 0.12 seconds. C. 0.20 to 0.30 seconds. D. 0.30 to 0.40 seconds. Answer. A. 0.12 to 0.20 seconds. Rationale. The normal PR interval is between 0.12 and 0.20 seconds. Question 15. What is a key characteristic of a wide QRS complex? A. Indicates atrial depolarization. B. Suggests a delay in ventricular conduction. C. Indicates sinus tachycardia. D. Shows normal conduction through the ventricles. Answer. B. Suggests a delay in ventricular conduction. Rationale. A wide QRS complex typically indicates delayed ventricular conduction, such as in bundle branch block or ventricular rhythm. Question 16. What does a flat T wave typically indicate? A. Hyperkalemia. B. Hypokalemia. C. Acute ischemia. D. Atrial fibrillation. Answer. B. Hypokalemia. Rationale. A flattened T wave is often associated with hypokalemia. Hyperkalemia usually causes peak T waves. Question 17. What is the primary treatment for symptomatic bradycardia? A. Synchronized cardioversion. B. Atropine administration. C. Amiodaron infusion. D. Defibrillation. Answer. B. Atropine administration. Rationale. Atropine is the first-line treatment for symptomatic bradycardia. Synchronized cardioversion is used for tachyarrhythmias, and defibrillation is used for ventricular fibrillation. Question 18. What is the clinical significance of a J-point elevation? A. Myocardial ischemia. B. Ventricular fibrillation. C. Myocardial injury or infarction. D. Sinus arrhythmia. Answer. C. Myocardial injury or infarction. Rationale. A J-point elevation is typically seen in the early stages of myocardial injury or infarction. Question 19. What does a prolonged PR interval on the ECG suggest? A. Heart failure. B. First-degree AV block. C. Atrial fibrillation. D. Ventricular tachycardia. Answer. B. First-degree AV block. Rationale. A prolonged PR interval, greater than 0.20 seconds, is characteristic of first-degree AV block. Question 20. Which of the following best describes the rhythm of atrial fibrillation on the ECG? A. Regular rhythm with a consistent PR interval. B. irregularly irregular rhythm with no identifiable P waves. C. Regular rhythm with visible P waves. D. Irregular rhythm with wide QRS complexes. Answer: B. Irregularly irregular rhythm with no identifiable P waves. Rationale: atrial fibrillation presents with an irregularly irregular rhythm and no distinct P waves. Question 21. What is the most common ECG finding in patients with hypercalcemia? A. Prolonged QT interval. B. Shortened QT interval. C. Peak T waves. D. Wide QRS complex. Answer: B. Shortened QT interval. Rationale: hypercalcemia typically shortens the QT interval. Prolonged QT interval is associated with hypocalcemia, and peak T waves and wide QRS are linked with other conditions. Question 22. What does our wave progression on the ECG suggest? A. Normal ventricular depolarization. B. Myocardial infarction. C. Left bundle branch block. D. Right ventricular hypertrophy. Answer: A. Normal ventricular depolarization. Rationale: our wave progression refers to the gradual increase in our wave amplitude across the precordial leads in a normal ECG. Question 23. Which of the following is characteristic of second-degree AV block, type 2 Mobitz 2? A. Progressive PR interval lengthening followed by a dropped beat. B. A constant PR interval with some dropped QRS complexes. C. Wide QRS complexes with no P waves. D. Irregularly irregular rhythm with distinct P waves. Answer: B. A constant PR interval with some dropped QRS complexes. Rationale: Mobitz 2 is characterized by a constant PR interval with occasional dropped QRS complexes. Question 24. What is the typical ECG finding in patients with left atrial enlargement? A. Prolonged PR interval. B. Biphasic P wave in lead 2. C. Tall peak T waves. D. Widened QRS complexes. Answer: B. Biphasic P wave in lead 2. Rationale: left atrial enlargement often causes a biphasic P wave in lead 2. Question 25. What is the characteristic feature of Wolff-Parkinson-White syndrome on the ECG? A. Prolonged PR interval. B. Shortened PR interval with a delta wave. C. T wave inversion. D. Narrow QRS complex. Answer: B. Shortened PR interval with a delta wave. Rationale: WPW syndrome is characterized by a short PR interval and the presence of a delta wave due to an accessory pathway. Question 26. What does a prolonged QT interval increase the risk for? A. Atrial fibrillation. B. Torsades de pointes. C. Ventricular tachycardia. D. Sinus tachycardia. Answer: B. Torsades de pointes. Rationale: a prolonged QT interval increases the risk of torsades de pointes, a life-threatening arrhythmia. Question 27. What is the typical ECG finding for someone with sinus tachycardia? A. Regular rhythm with a heart rate above 100 BPM. B. Irregularly irregular rhythm with absent P waves. C. Slow and regular rhythm with visible P waves. D. Wide QRS complex with rapid ventricular rate. Answer: A. Regular rhythm with a heart rate above 100 BPM. Rationale: sinus tachycardia is characterized by a regular rhythm and a heart rate greater than 100 BPM. Question 28. What is the normal duration of the QRS complex? A. Less than 0.12 seconds. B. 0.12 to 0.20 seconds. C. 0.20 to 0.30 seconds. D. Greater than 0.30 seconds. Answer: A. Less than 0.12 seconds. Rationale: the normal duration of the QRS complex is less than 0.12 seconds. A prolonged QRS indicates a bundle branch block or other conduction abnormality. Question 29. What does an inverted T wave typically suggest on the ECG? A. Myocardial ischemia or infarction. B. Left ventricular hypertrophy. C. Atrial fibrillation. D. Hyperkalemia. Answer: A. Myocardial ischemia or infarction. Rationale: inverted T waves are often seen in patients with myocardial ischemia or infarction, indicating a lack of oxygen to the heart muscle. Question 30. Which of the following arrhythmias is most likely to result in hemodynamic instability? A. Sinus arrhythmia. B. Atrial flutter. C. Ventricular fibrillation. D. Atrial fibrillation. Answer: C. Ventricular fibrillation. Rationale: ventricular fibrillation is a life-threatening arrhythmia that leads to the loss of effective cardiac output, causing hemodynamic instability. Question 31. What does a delta wave on the ECG indicate? A. Atrial fibrillation. B. Left ventricular hypertrophy. C. Accessory conduction pathway, WPW syndrome. D. Myocardial infarction. Answer: C. Accessory conduction pathway, WPW syndrome. Rationale: the delta wave is a characteristic feature of Wolff-Parkinson-White syndrome, caused by an accessory conduction pathway. Question 32. What ECG finding is characteristic of a myocardial infarction? A. ST segment elevation. B. Absent P waves. C. Tall peak T waves. D. Prolonged QT interval. Answer: A. ST segment elevation. Rationale: ST segment elevation is a hallmark of myocardial infarction, particularly in STEMI, ST elevation myocardial infarction. Question 33. What ECG feature is associated with a bundle branch block? A. Narrow QRS complexes. B. Wide QRS complexes with a notched appearance. C. Prolonged PR interval. D. Absent P waves. Answer: B. Wide QRS complexes with a notched appearance. Rationale: bundle branch block causes wide QRS complexes with a notched or bifid appearance due to delayed conduction. Question 34. What is the primary treatment for stable supraventricular tachycardia, SVT? A. Defibrillation. B. Synchronized cardioversion. C. Valsalva maneuver or adenosine. D. Atropine administration. Answer: C. Valsalva maneuver or adenosine. Rationale: the first-line treatment for stable SVT is to try vagal maneuvers, e.g. Valsalva, or administer adenosine to break the rhythm. Question 35. Which of the following ECG changes is most commonly associated with pericarditis? A. Elevated ST segment in multiple leads. B. Prolonged QT interval. C. Tall peak T waves. D. Atrial fibrillation. Answer: A. Elevated ST segment in multiple leads. Rationale: pericarditis is often associated with diffuse ST elevation in multiple leads. Question 36. What is the characteristic feature of third-degree, complete, AV block on the ECG? A. Regular P waves with dropped QRS complexes. B. No relationship between P waves and QRS complexes. C. Progressive PR interval lengthening. D. Irregularly irregular rhythm with no P waves. Answer: B. No relationship between P waves and QRS complexes. Rationale: in third-degree AV block, there is complete dissociation between atrial and ventricular activity, with no relationship between the P waves and QRS complexes. Question 37. What does a wide QRS complex suggest? A. Sinus arrhythmia. B. Conduction delay or bundle branch block. C. Atrial fibrillation. D. Sinus tachycardia. Answer: B. Conduction delay or bundle branch block. Rationale: a wide QRS complex suggests a delay in ventricular conduction, such as in bundle branch block. Question 38. What is the most appropriate first-line treatment for ventricular fibrillation? A. CPR and defibrillation. B. Atropine. C. Synchronized cardioversion. D. Amiodarone. Answer: A. CPR and defibrillation. Rationale: ventricular fibrillation is a life-threatening arrhythmia that requires immediate CPR and defibrillation to restore normal rhythm. Question 39. What is the characteristic finding of a myocardial infarction in the lateral wall? A. ST elevation in leads V1, V2. B. ST elevation in leads V3, V4. C. ST elevation in leads I, AVL, V5, V6. D. ST elevation in leads 2, 3, AVF. Answer: C. ST elevation in leads I, AVL, V5, V6. Rationale: ST elevation in leads I, AVL, V5, V6 indicates a lateral wall myocardial infarction, typically affecting the left circumflex artery. Question 40. What does the presence of J-point depression indicate? A. Myocardial ischemia or injury. B. Hypokalemia. C. Acute myocardial infarction. D. Right ventricular hypertrophy. Answer: A. Myocardial ischemia or injury. Rationale: J-point depression is often seen in patients with ischemia or early stages of myocardial injury.
If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.